it's Mayor David Stahl. Welcome to another edition of Challah, East Brunswick. East Brunswick is a great community that we all call home, and one of the reasons I personally believe that East Brunswick is such a wonderful community is the individuals who live in our town and enrich the lives of other individuals. You know, so many of us give back in different organizations that we find suit our particular needs and wants. And I'm pleased to be joined today by Dr. Michael Nissenblatt, who's probably one of the individuals that I believe is one of the preeminent people who give back to our community. Let me give you a little bit about the basic information about Dr. Nissenblatt. He founded the Central Jersey Oncology Center in 1981, received his medical degree from Columbia University of Physicians and Surgeons in New York, did his internship and his residency at Johns Hopkins down in Baltimore. He joined the faculty of Robert Wood Johnson Medical School in 1978 as their first full-time oncologist. He's presently a clinical professor at the medical school and is the associate director of oncology at Robert Wood Johnson University. He's been a dedicated member of the American Cancer Society for many years, serving as its president and perennially leading fundraiser, which is to be commended. He's the past president of the New Jersey Oncology Society. And Dr. Nissenblatt has received numerous awards and honors, including annual listings in Top Doctors in New York, Northeast region, Best Doctors in New York, and Best Doctors in New Jersey. This is not a medical show, but certainly no one can take argument that you are, in your field, one of the leading experts. So I congratulate you on that.
Thank you.
We're here today to talk about your tremendous work in the community that's related to your work as an oncologist, about the different foundations and how you go about helping so many people in their lives. First of all, where do you find the passion to do all this?
From the patients themselves. When you see a person looking for answers, what will their futures hold? Where will they be able to lead their families? You learn that it's critical to get under the skin of every individual, to help lead them toward an appropriate goal for their future. And touching them as a physician is just not enough. It's good to have book learning. It's excellent to be up to date on the most modern of technologies and treatments. But one has to have much more than that if you are really going to help heal them. There are wonderful, wonderful physicians that I work with every day in my practice and in my community. And those who are truly special are those who reach further and who find additional ways beyond the medical aspects to care for their patients and to lead them forward. That's really where I get my passion. When I meet a young person who's got 2 or 3 children that are not yet raised, and it's clear that their goal is to get, if not cured, to get to the point where their children can again be independent and be on their own. Most people who are diagnosed with cancer have the fear that they will lose their lives. Fortunately, most of the time that is unfounded. Using our modern treatments, more than 70% of more than 70% of people with cancers are cured. And in some instances, those numbers are much higher. So that for early stages of breast cancer, the cure rates are well above 90%. For testicular cancer, it's virtually 100%. Even for ovarian cancer, we can cure many people in the ranges, depending on the amount of cancer or the stage, in the 50 to 60% range. But it's very important for us to try to establish appropriate goals so that people who feel that their lives are threatened by cancer may not really have their lives threatened once they understand the nature of their disease and the biology of the disease and the nature of our treatments. And other people who may have a very, very advanced disease may not really have that understanding. And it's critical that we then establish a goal of palliation or comfort or control of the disease. So we try to establish appropriate goals for each individual. Cure when that's appropriate, comfort when that's appropriate. One of the most famous physicians in history, the father of modern medicine, William Osler, stated that physicians can rarely cure disease. Now, he was talking in the 1880s. Physicians can rarely cure disease, can often palliate, meaning to control, but can always provide comfort. And my job as an oncologist, and the jobs of most physicians, is to try to establish appropriate goals for each person, for each illness, for each level of illness that they have, and to provide the understanding for the patient and for the family, and lead them down the path of cure or lead them down the path of comfort, but to try to match reality with the goal and the goal with the reality of their illness.
You know, again, even myself, when you hear the word cancer, you always think the worst. And the survival rates that you mentioned are actually pretty astonishing. But there is in terms of the families that are affected, it's not just the patient, it's the families that are affected that you have to also deal with.
That's one of the most remarkable and pleasurable aspects of being in medical oncology, because it's really a family unit. We're never just treating the person alone. We're treating the children, we're treating the parents of that person, and we're treating the immediate colleagues and the immediate friends of the person who's been ill. Most people don't come to our office alone. They come with either a very close friend or a family member, and it's enjoyable to meet them. It's a delight to educate not just one person, but all of them about the disease. I frequently will take out colored markers and draw a diagram, a cartoon that represents or symbolizes the nature of the disease. Do you know that when people are done listening to that conversation, it could take anywhere between half an hour and an hour, they have as good an understanding about the nature or the biology of the disease as I do. There's nothing secret about having an understanding about cancer or medicine. What's troublesome, I think, are the words. And if we can break out of some of the lingo and use common words, most people can understand the nature of their illness. And then they and their friends or family members become partners in the process of moving forward and getting back to good health.
You think the family support is critical also to the needs of the patient?
They're absolutely critical. Everyone needs to identify a caretaker. The course of our treatments may weaken a person's health. It may, for a period of time, weaken their ability to overcome infections. If a person develops an infection, they may in fact be unable to convey just what the problem is. They might feel that they're ill. They might feel a little bit weak. But in reality, the cause of it could be an underlying bloodstream infection, or it could be even a pneumonia that's manifesting as confusion or sleepiness or an unusual behavior. That person who appears to be angry or belligerent may not be angry or belligerent. That might be the expression of an underlying infection. And so it's critical that everybody have a caretaker, a provider who can help them through their illness, be their eyes, be their ears, and convey messages to the physician in a timely way to intervene and take care of the problem.
So you've gone beyond the role of, the strict interpretation of a medical oncologist by some of the foundation work that you've done, some of the charitable work that you've done. You recently started Partners in Healing. What is the purpose of that? And first of all, what was your rationale for even getting that started?
A little over 2 years ago, one of my colleagues referred a patient from Sloan Kettering to me. It was a Friday night, and there was a lady who had very advanced ovarian cancer. She was 51 years old. The ovarian cancer did not respond to any of the therapies that she had been given, and it was clear that she was ill enough that the family was making preparations possibly for the end of her life. She came to Robert Wood Johnson at 10 o'clock at night on a Friday, and I met with the family, and we began a treatment course to try to control many of the symptoms that she was experiencing, and they were very severe. She survived only about 11 days and passed away in the hospital. However, her family was extraordinarily grateful, and her husband, who is a forensic accountant, realized that he had some special opportunity to help others. And he told me that during a year or so that his wife had been ill, he had noted many people were unable to take care of financial aspects of their illness, travel, and similar items, and that he would like to help me to establish a program that would be able to fund things that people might not be able to pay for personally or their insurance might not pay for. Things such as transportation for radiation therapy, co-pays on medicine, insurance, if they're unable to be employed because of their illness, then other items such as even a rent check or a lease on an automobile. And we spoke about that, and we decided that that would be a good way to initiate a foundation, and we started Partners in Healing. With the devoted efforts of my attorney, Richard Anslow, and his wife, Rena Anslow, and two very close friends, Barry Lurie and Iris Lurie, as well as my wife, Marlene, and one of my dedicated public relations directors in our office, Dorothy Balweg, we began Partners in Healing 2 years ago in December. And since then, we have done some, what I think is really remarkable work, far outside of what we would normally expect medical care or medical provisions to include. For example, the very first person who we helped is a gentleman who has a very unusual condition. It is called Lynch syndrome, or hereditary non-polyposis colon cancer, a condition which led in this man to having had several colon cancers. He had lost 2 brothers from colon cancer, his mother from uterine cancer. It's a syndrome in which there's a predisposition toward cancer. He also had diabetes. He also had kidney failure and was on dialysis. And he also developed a very unusual and painful disorder of his skin and his joints, that he was unable to fold his hands or stand for very long because of the thickening and the pain in his arms and legs. Michael, his name, lived with his sister on the 2nd floor of a large house in Somerville. He had a car. He could normally drive. But because of the pain in his arms and legs, he was unable to travel down the 2 flights of stairs to get to the driveway. The very first project that we were involved in was building a ramp from the 2nd floor to the 1st, and from the 1st floor to the ground floor so he could get to his car. And with that and his electronic wheelchair, he was able to go back into the environment and travel, shop, and carry on his life's activities much more readily than he otherwise had. He was otherwise shut in. He was now able to get outside of his house. There's a woman recently with acute non-lymphocytic leukemia, a very dangerous disease that was resistant to all therapy. Not my patient, a patient from Central New Jersey, who is friends with one of my cousins. My cousin was fortunate enough to have been cured of acute leukemia at Robert Wood Johnson, and she just this past week finished her 5th year in remission. She met this woman with resistant leukemia just a few months ago. Her husband was unemployed, 3 children, and just before Christmas, it was clear that they were not going to have any Christmas. My wife and Rena Anslow and several others got together, and with the help of the foundation, they made a Christmas for them. That was a critical thing for them. And I'm happy to say that this woman just had a bone marrow transplantation, a stem cell transplantation like my cousin, and it appears that she, although it's early, it appears that she too is in remission.
That's great.
So it's a wonderful thing for that young family to help them through.
I mean, they're simple ideas, but they mean so much to the families at the time.
It's critical. I was walking from Robert Wood Johnson to the Cancer Institute about 4 months ago, and I noticed that one of my beautiful 34-year-old patients who had been cured of breast cancer and looked perfectly healthy was standing next to a man using a crutch, looking like he was in his late 20s or early 30s, pale, sad, and obviously in pain with a limp. And I found out that he had colon cancer, which had spread to his bones. He had a broken bone, and his disease was not responding to radiation therapy. He was unemployed. He really couldn't pay for the rent in his house. And we had him communicate with Barry Lurie, and we were able to provide funding to him and his family to assist in the expenses of their immediate living needs, and put them back on a road to solvency at that point.
Talk about funding. How do you get your funds, and how can residents of East Brunswick help? People
can make a contribution if they're inclined to do that, if they have a few extra dollars, to Partners in Healing, and to send it to care of Michael Nissenblatt at our office in New Brunswick, which is at 205 Easton Avenue, New Brunswick, New Jersey. we've found some wonderful donors out there who are willing to help, and to help pay for expenses that have gotten people to their treatments for radiation therapy, but more importantly, to give them the sense that they're not battling their disease alone, right. That even though they're underemployed or unemployed, and even though they feel that their lives, and their lives may be, in reality, threatened by disease, that they are partners with other people to help them move their lives forward. And knowing that there's a sense of comradeship in the environment from anonymous people that they've never met and never will meet makes it an even greater expression of compassion by those donors.
Do you feel that patients who are suffering from any form of cancer need that more so than other patients?
Absolutely. To know that your illness is being fought in a partnership with others is just a most wonderful, wonderful experience. It is something that we don't think about very often. Most of us will make a contribution, and we expect to have an acknowledgement of that, and maybe we'll take it as a tax deduction. When you make a contribution to somebody who you'll never meet, the symbolism of that anonymous gift is magnified many-fold. It's very much like one of our other foundations, the Challah Foundation.
Right, I was just going to bring that up.
We started a Challah Foundation in 1995. I remember seeing a lovely woman with multiple myeloma, a bone disease, who was hospitalized, couldn't get up out of bed, in pain. I was making rounds and meeting her for the first time on a Friday morning. And in those days, I was going to Highland Park and picking up a couple of loaves of challah, really a symbolic piece, a symbolic loaf of bread, symbolizing resilience, hope, harmony, healing, restoration. It symbolizes all of those things, which is really why it's used on the beginning of the Sabbath. Well, when I saw this woman lying in bed and very depressed, it occurred to me that she might respond to an extra loaf of challah, and I was getting two. So I went to my car, brought it to her, and she, of course, knew what it was. She is a member. She lives in East Brunswick. And she smiled, and the following day when I saw her, she asked if she might be assisted by someone to get out of bed and to sit in the bedside chair, which she did for a few hours. And about a week later, two things happened. The first thing that happened was that she actually left the hospital and went to rehab for a week. And the second thing that happened was that her roommate, a lady who knew nothing about challah, asked for a loaf herself. And that was really the beginning of it. And as time went on, I started buying more and more challahs in Highland Park and bringing them to both St. Peter's and Robert Wood and distributing them on my own. When it reached 30 challahs a week, it was clear that I could neither carry those loaves on my own or afford to pay for them on my own, because they were running a significant amount. And little by little, people started to contribute their time. One of the very first people, Leon Kartzmer, helped me actually establish that foundation. Another very devoted person, my close friend and colleague, Richard Sherwood, who I'm very sorry to say just passed away this past May, helped me carry on the acts of this foundation. We at this time have 9 volunteers. 4 of them are Jewish, 5 of them are non-Jewish. And we give out 130 challahs, chalot is the proper word, every week. And we give out about half of those in the hospital and the other halves in our offices to people of all faiths, all backgrounds, all beliefs. And the one thing that everybody has in common is that they are fighting cancer and that they need a sense of harmony and hope and resilience. And it is quite obvious that nobody would give an essential element of life, which is water and bread, to somebody who doesn't have hope, to somebody who doesn't really have a future. And so the symbolism underlying all of this is that giving a loaf of bread is saying, you're going to make it. You're going to come through this, and we're going to help you do it. The amazing thing here is that the money that funds the bread from many, many donors at this time is a form of double anonymity, because the funds are coming from people who are anonymous to the recipient of the bread,
Right.
and the bread is coming from people who are delivering it and who in turn are anonymous to the recipient. So it's double anonymity, a double mitzvah, if you will, a double blessing by people of all backgrounds. People love it. And people feel a great sense of uplifting and spiritual healing by doing that.
I know in the township when we do our food baskets to individuals in need in our community, they come from anonymous gifts as well, and they're given anonymously to people in need. And those, I hear from both sides, people that give and those that receive, who don't know each other and will never know each other. But the ones who receive are grateful, and the ones that are giving know that they're helping those in need, and it's the same situation.
The person who gave me the idea of creating it into a foundation was a wonderful woman by the name of Paula Heyer. And I was taking care of Paula since she was in her early 30s, and she had breast cancer. She's a beautiful, blonde, blue-eyed woman who had a very serious form of breast cancer. And one day, on a Friday morning, I was delivering a loaf of bread to her, Challah, and she handed me an envelope. And I opened the envelope, and in it was a little card and 3 crumpled $1 bills. And I asked her, what did that mean? And she told me, Dr. Nissenblatt, I've known you now for several years, and I know that my future is uncertain and that my time may be short. I want you to know that receiving Challah on Friday mornings was something that has given me a sense of healing and hope for the future. I would like you to take these dollars and begin a foundation so that the spirit of healing can reach across nature to help the next person who occupies my bed. And that was really, or those were really the words that led me to start the foundation. And once again, Richard Anslow was kind enough to be the legal support to make that come true. And it's been a successful foundation ever since.
Well, we've talked about 2 different foundations that are helping those that are in need, suffering from the onslaught of cancer. You also have, through your Nissenblatt scholarships, another funding to help those that will be future Dr. Nissenblatts, we hope. So why don't we talk about how the Nissenblatt Scholarship Fund works and what you have seen over the years in terms of the people that have gone through that.
A few years ago, the Chamber of Commerce in East Brunswick, particularly through Audrey Whitman and Judy Zone, came to me, and they knew that I always enjoy teaching young students, whether they be in high school or whether they be in college or at Robert Wood Johnson Medical School, and bringing them to the bedside and teaching them about medicine and about the art of healing. And they realized also that my 2 daughters, who are now grown, selected healing arts of a different sort. My older daughter, Paulina, has become a certified acupuncturist after going to a 4-year school for that. And my younger daughter, Dory, is a marvelous yoga teacher who has mantras and a beautiful voice. She actually sings in Sanskrit, not Hebrew, but Sanskrit. She's pretty amazing. And both of them have taken different aspects of the healing arts, what I would call the Eastern arts or the Asian arts, and kind of balanced me. I'm particularly Western. When I had the opportunity, my office in East Brunswick was built in such a way that my office occupies a corner of the office, and there are 2 offices, 2 examining rooms adjacent, one on the east side, one on the west side, with sliding doors. And I would take a student of Western medicine and put a patient with the student of Western medicine there, and I would take another patient and a student of Eastern medicine in the next room. They would examine the patients, talk to the patients, and then present their findings. That was a way of teaching me what Eastern medicine had to offer and what Western medicine might have to offer. And having the East look at what the West identifies and vice versa is a good way of opening your eyes. Western medicine evaluates things in a very linear way. We measure things, whereas Eastern medicine evaluates things in a philosophical way, in a manner which is spiritual rather than linear. So we can talk about measurements and identify them in units or sizes or organs. However, in Eastern medicine, things such as heat, slippery, chi, words that are foreign to us, even when we talk about spleen chi or liver chi, it doesn't mean the liver organ or the spleen organ. It means something different. And one gets a feeling for what these actually mean and translate. They mean the same thing in terms of the patient. They're simply different ways of expressing the symptoms from the perspective of the physical findings. Well, in any event, the students have learned a great deal, and I learned a great deal. With Judy Zone and Audrey Whitman, we thought maybe we could develop a scholarship for students in East Brunswick and students who are graduates of high schools in New Jersey who would decide to go on into a future career in either Western medicine or Eastern medicine. And we select either 3 or 4 recipients of a generous award every September. And we therefore sponsor students and help them pay for their increasing costs of medical education. The costs of Eastern education is not very different from the costs of Western education, and so everybody needs a little bit of help right now. These are not full scholarships, but they're a substantial partial scholarship that help them. This past season, we identified a wonderful student of dentistry, and she is in a dental school in New Jersey and doing great work. She may actually go into dental oncology, which will be very interesting. We've supported people both at Robert Wood Johnson Medical School, the schools in southern New Jersey, as well as the Pacific College of Oriental Medicine in New York and other schools of Eastern medicine that are present on the East Coast. The students have all benefited by it. They've welcomed the contribution, they've welcomed the extra support, and it's helped further their careers. They usually get back to me as their careers continue.
We are almost out of time. I know we didn't have an opportunity to talk about your involvement with the American Cancer Society, but I know that we will run that on the screens about how people can contribute to not only the American Cancer Society as well as to the different foundations we spoke about today. I mean, I was listening to you, and you talked about yourself following more the Western medicine, but I think if you look at your work through the foundations, I think you're the perfect blend of East meets West when it comes to your overall treatment to your patients. You know, I commend you on that, not only for your medical work, but you know, your reach and your compassion for humanity, quite frankly, is quite remarkable. So I want to congratulate you, Marlene, all the individuals involved in the different foundations that you're involved with for giving so much back to not only your patients, but the greater community here in the Middlesex County.
I thank you very, very much. I thank my wife for making it possible and for understanding that there are more things than just medicine that carry me forward, and we work on these things together.
Well, I appreciate your time, and I would again encourage all residents that are watching, you know, take the time. I know these are difficult times for many of us economically, you know, whether it's $1, $5, whatever you can afford to give. Find it in your heart and compassion to give to any of the foundations that we've discussed here today. Because trust me, I know that Dr. Nissenblatt and his group of volunteers are going to find their way to make sure that your money's well spent and the individuals in need will find the compassion that we all feel for them. So again, thanks for watching, and thanks for your support of Dr. Nissenblatt.